Tropical Infectious Diseases Block for the 7th semester in Medical Faculty. The Tropical Infectious Diseases Block is a crucial component of medical education in tropical country like Indonesia. Considering the country's tropical climate and high prevalence of infectious diseases caused by microorganisms, bacteria, viruses, parasites, or fungi, often associated with tropical environmental conditions. Below is a detailed explanation of this block. 1. Introduction. Epidemiology of tropical infectious diseases. A. Characteristics of tropical regions. High temperatures and humidity. An environment conducive to the growth of vectors such as mosquitoes and rodents. Uneven access to clean water and sanitation in certain areas. B. Major infectious diseases in Indonesia. Parasites, malaria, filariasis, schistosomiasis, toxoplasmosis. Bacteria, leptospirosis, typhoid fever, tuberculosis, TB. Viruses, dengue, chikungunya, rabies. Fungi, histoplasmosis, aspergillosis. C. Risk factors. Poverty, population density, climate change, and urbanization. 2. Pathophysiology of tropical infectious diseases. Students study the mechanisms of infection by various tropical pathogens, including their modes of entry, reproduction, and disease causation. A. Parasitic infections. 1. Malaria. Causative agent, Plasmodium, primarily P. falciparum and P. vivax. Vector. Anopheles mosquitoes. Mechanism. Parasites invade red blood cells, causing hemolysis and anemia. Symptoms. Periodic fever, chills, anemia, splenomegaly. 2. Filariasis, elephantiasis, causative agents, Wuchereria bancrofti, Bruchia malayi. Vectors. Culex, Anopheles. Aedes mosquitoes. Mechanism. Obstruction of lymphatic vessels by adult worms. Symptoms. Chronic swelling of the limbs or genitals. 3. Toxoplasmosis. Causative agent, Toxoplasma gondii. Mechanism. Infection through consumption of undercooked meat or exposure to cat feces. Symptoms. Fever, enlarged lymph nodes, complications during pregnancy. B. Bacterial infections. 1. Typhoid fever. Causative agent, Salmonella typhi. Mechanism. Transmission via contaminated food, water. Symptoms. Persistent fever, gastrointestinal disturbances, hepatosplenomegaly. 2. Leptospirosis. Causative agent, Leptospira interrogans. Mechanism. Transmission through contact with water contaminated by animal urine, e.g., rodents. Symptoms. Fever, muscle pain, red eyes. Complications like kidney failure. 3. Tuberculosis. Causative agent, Mycobacterium tuberculosis. Mechanism: airborne transmission via droplets. Symptoms: chronic cough, weight loss, mild fever. C. Viral infections. 1. Dengue hemorrhagic fever, DHF, causative agent, dengue virus, serotypes DEN1 to DEN4. Vector: Aedes aegypti mosquitoes. Mechanism: infection of vascular endothelial cells, leading to plasma leakage. Symptoms: high fever, joint pain, rash, shock in severe cases. 2. Rabies. Causative agent: rabies virus, rhabdovirus. Mechanism: transmission through bites from infected animals, dogs, cats, bats. Symptoms: muscle spasms, hydrophobia, fatal without treatment. 3. Chikungunya. Causative agent: chikungunya virus. Vector: Aedes aegypti. Symptoms: sudden fever, severe joint pain, rash. D. Fungal infections. 1. Histoplasmosis. Causative agent: Histoplasma capsulatum. Mechanism: infection through inhalation of spores from soil contaminated by bird, bat droppings. Symptoms: fever, cough, chest pain, resembling TB. 2. Aspergillosis. Causative agent: Aspergillus fumigatus. Mechanism: infection through inhalation of fungal spores. Symptoms: hemoptysis, shortness of breath, lung lesions. 3. Diagnosis of tropical infectious diseases. A clinical examination. 1. History taking. Travel history to endemic areas. Specific symptoms such as fever, rash, or swelling. 2. Physical examination. Hepatosplenomegaly in malaria. Jaundice in leptospirosis. B. Diagnostic tests. 1. Laboratory tests. Blood smear, malaria parasite detection. Blood culture, bacterial detection in typhoid fever. ELISA NS1 antigen, dengue diagnosis. 2. Imaging, chest X-ray. Tuberculosis, abdominal ultrasound, organ enlargement in filariasis. 3. Molecular tests, PCR, specific pathogen detection. 4. Treatment of tropical infectious diseases, a pharmacological therapy. 1. Malaria, artemisinin-based combination therapy, ACT. 2. Typhoid fever, antibiotics like ceftriaxone or ciprofloxacin. 3. Dengue, supportive therapy, rehydration. B. Vaccination, rabies vaccine. BCG, for TB, and dengue vaccine in certain areas. C. Preventive measures, vector control, fogging, mosquito nets, removing stagnant water. Sanitation and hygiene education. 5. Prevention and control. A. Primary prevention, mass vaccination for rabies and filariasis. Promoting environmental hygiene. B. Secondary prevention. Early screening in high-risk populations. Prophylaxis for specific groups, e.g., pregnant women in malaria-endemic areas. C. Tertiary prevention. Rehabilitation for patients with complications, such as restoring limb function in filariasis. 6. Clinical approach and case management. Students are trained to 1. Establish a diagnosis based on symptoms and epidemiological history. 2. Select appropriate treatments following national guidelines. 3. Educate patients and families about preventing recurrent infections.